Good afternoon, everyone. Thank you for joining us today in our series of bi-monthly webinars. It is truly a pleasure to count with each and every one of you. Um, for us, this is the first webinar of 2022. But before beginning everything, I would like to ask from you 1 minute for us to grant those who are still in the process of joining so they can be in and they can be set. After that, we will be beginning at, let's see, um, 301. So at that moment, at that minute, I will begin to talk again. That was quick. Time's up. Once again, welcome all of you, the ones who are watching us and the ones who are going to be talking and sharing this amazing information. Today, I would like to welcome you to our webinar, The Quality Assurance Project that Enhances the Patient Care Experience. With me, I will have an amazing team of individuals who I have the pleasure of working with. I do want to share some insights before we would have a segment after the webinar ends that it's the QA segment. Please feel free to ask those questions. You are going to go to your, there's a frame on your right where you can see a couple of words sharing webcam audio. You can just go to chat, press that there, and you can place your questions in the moment that we are going to be answering those questions. So just to jump right into it, I want to welcome today Lillian McCann and Stevenson Pierre, our amazing team members of the operations team. Welcome, both of you. How are you feeling today?
We're doing great, Lucille. Thank you so much for putting this together. We're really thrilled, grateful, and humbly honored to be opening this series for you this year.
We're definitely happy to be here, Maciel. Thank you very much for inviting us, and super excited that it's the first one and we're setting the bar.
Yes, you are indeed pioneers. So I am very happy to have you both. And to add to you today, my name is Maciel Popa. I am the current director of marketing and communications in CCD, and I will be supporting this amazing team today as your host. So I would like to share with you that Lillian currently holds an undergraduate degree in organization psychology, and she has a master's degree management and productivity, but more than 20 years of experience in the contact center industry. As per Mr. Citizen Pierre, he is currently completing his undergraduate degree of international business at Universidad APEC, and he has more than 10 years of experience in the contact center industry. So to expand a little bit about what we are in CCD, we are a knowledge process outsourcing focused specifically in providing your imaging centers as scheduling experts the support you need. We have been specialists in patient care for more than a decade, and we have been serving more than 200 imaging locations across the US. It is indeed amazing. We have already scheduled 750,000 appointments per quarter, and we service 4 of the 5 largest brands in radiology in the US. So I don't want to take any more time because I know you're all eager to know about this amazing information that today Lillian and Stevenson are going to be sharing with us. So Lillian, Stevenson, I am passing you the baton. Good luck.
Thank you. Thank you so much again, Maciel. Thank you for the time as well of the time of the audience that has joined us today. We hope that the insights offered will add value to what you do in your day-to-day. I'd like to mention that we are talking about quality measurements, or as we call it in the contact center arena, quality assurance. Others can call it call monitoring, quality monitoring, quality auditing, things like that. But in order to get a quick intro on how we define quality assurance at CCD, I'd actually like Stevenson to go ahead and kick us off. Can you do that for us, Stevo?
Sure, Lilium.
Thank
So
you.
in CCD, you're welcome. We definitely define QA quality assurance as the practice of measuring, evaluating, scoring interactions between patient and healthcare specialist. It's literally looking at the attributes that have been defined and checking what hits or misses our specialists work through in the different types of interactions hosted, such as, we'll say, chat, phone calls, email responses, to say the least.
Yeah, definitely. So that's a key concept, to know that at the contact center, we're not only looking at phone calls, it's a whole holistic view. So, in layman's terms, what this measurement, when it's clearly defined, it's a clear process of standards that allow us as well to measure them through the call flow, the QA form, any other attributes, as Stevenson had mentioned, as well as the key performance indicators, which will be those precise attributes of scoring that are taught to the employees through the training process at each of the different touch points that they may have, so they know exactly what to expect in the different type of interactions, as well as ensuring that we're meeting the compliance to all aspects that could apply to the role that they are working for. The dynamic item of this process is that it gives a guide not only for the employee management per se of the day-to-day, but it also drives a holistic visibility of a feedback loop as well as process management of the organization or the team at hand. Stevenson, what do you think about that management piece?
Well, you know what, Lilium, you're actually on the money. And just to give everyone a mental picture of where we're going with this, I'll share a quick feedback experience that happened in our organization. So we had a specialist that kept on struggling to place diagnostic mammograms. So we took the time to get the most recent evaluations. We also pulled some calls and were able to identify that she was not using the correct screening questions. Now, being able to provide clarity that the difference between one and the other, speaking of diagnostic and screening mammogram, are symptoms, it made a whole difference on the whole feedback experience. And now, guess what? She's actually scheduling them like a pro.
Sounds like magic almost, when you have that well-defined call flow, that well-defined attribute scoring process that gives you a performance management tool for a feedback loop. It's like everything falls into place.
Yeah,
So, right?
yeah, I know.
It's a good deal. So let's review some of the importances of quality assurance for an outpatient center, right? One of the importances or most important aspects we can say in quality assurance is the efficiency pieces. How effective are these interactions that the specialist hosts to drive an improved experience that could convert to a higher appointment conversion? Unfortunately, not every patient that calls to schedule goes through the process completely. Sometimes they back out, sometimes they do move forward. And at the end of the day, what trickles down is how they feel through that interaction. Are they confident in that interaction? Do they trust the other person on the other line that's gathering the demographic information in order to do that process? We need to be really mindful that patients are calling in and they're going through some items that need to be taken care of or looked at, and remembering how we make them feel and the confidence that we give them and the reliability that we can provide in the process will allow us to complete that scheduling appointment or not. And in order to give them that confidence, the accuracy pieces outside of the skill of the soft skills are definitely needed. You know, Steve, shed some light for us on accuracy.
Well, this is a very important piece because evaluating accuracy really guarantees that the practices our patients are scheduling at, they're reliable and fast at what they do. Now, you could ask yourself a few questions. What key indicators are needed? Will I, as a patient, need to provide the same information each and every time I call? And what measurements or questions should we take into consideration to guarantee that I am in fact the patient on file? And one more thing is the relevant information on file to ensure the right exam and that it's scheduled and for the right time. These are really important things that we definitely need to look at. And I'll quickly go back to the example that I gave earlier in regards to the diagnostic mammogram. So we know that a diagnostic mammogram requires more time in the books than a screener. Now, prior exams may be required as well, but then providing this information ahead of time to the patient and doing it in a timely manner actually reduces the risk of disappointment, which is a big word, dissatisfaction. That's for when they show up for their exam. It has a great impact.
Yeah, definitely disappointment could have a great impact. And why does it have a great impact? It could impact referrals, it could impact affiliation. You know, if we're not scheduling correctly, gathering the correct information for the patient, sending them to the nearest location to them at any point in time, all of this can impact their experience. And who do they go to as soon as they have that exam done? They go back to the referring doctor. They go back and look at the results. So once they have that conversation, if this patient is a longtime affiliate of the doctor's office and replies with poor experience, you know that you're going to get that escalation for sure, you know, and if you don't get the escalation, then at some point, if this doctor's medical office can, they're going to refer patients elsewhere if possible, therefore impacting your future referrals for some of those one-time occurrence exams. Would you agree with that, Steve?
Oh yeah, completely. Because getting the appointment right that very first time, it'll drive a faster turnaround time at
Mm-hmm.
the practice, of course, and also maintain a good relationship. And that's only gonna do one thing. It'll drive an excellent reputation for the facility.
And this is a good segue to best practices of an in-house and or even outsourced quality care program. Why don't we start talking about those framework items, Steve?
Sure. Well, the first thing I want to talk about is we want to look at a good and effective framework that focuses on the following aspects. So we'll mention first, did it target the practice's goals? Is it measuring patient experience, specialist interaction on another end through a survey tool such as a Net Promoter Score, commonly called NPS, or CSAT for customer satisfaction? And the last but not least, I'd like to think of, we'll say, are the key success factors actually well defined? Lilium, speaking of key success factors, can you please enlighten us on this one?
Yeah, definitely, Stevenson. So obviously, key factors will entail anything that has to do with soft skills, accuracy of the process, as well as any compliance items. And it's really easy to stray away from doing what's right when we take a QA framework and instead of evaluating it as a streamlined process, start per se policing some interactions that could create a blur or even a balloon effect on the expected results. A common practice for soft skills, for example, is measuring dead air. You know, why do we have excessive hold times? Why do we have excessive dead air? Why don't we start counting those seconds of silence in order to reduce, control those awkward moments in the evaluation? You know, instead of evaluating that, why don't we look at something more effective as evaluating the proper use of transitional phrases through the call flow? You know, how are they using those connectors in order to ensure that there's not long idle times in the phone call? We always say looking at those will reduce average handle time, but it's not necessarily doing what's best for the experience, you know, and could make a goal stray in the completely wrong direction. So obviously having that clear framework in regards to what's important. Soft skills, we're looking for empathy above all at a patient experience, and obviously any compliance measurements to ensure that these are well practiced and viewed through that QA assessment, right? These well-defined, as Stevenson has mentioned numerous times, will be key to the successes, not only at the center level, but actually at the specialist level as well.
Well, Lilium, now that you bring up the measuring dead air part of it, I'll piggyback on that.
It's so common.
Triggering or having the clear reporting to identify opportunities, I believe, is key to driving continuous improvement in all interactions, regardless of the channel. Knowing what to measure, looking for those negative trends that can be, we'll say, enhanced or improved throughout the process, and also communicating them to the support groups that actually trains the folks, or even the admin staff that reinforces and provides feedback, um, leverages the improved results as an end game. I don't know if I processed it right, but what would you say about that?
Yeah, definitely. You know, it makes sense. It's not only looking at the process, but also looking at the educational aspects of what this framework provides. You know, we're looking for any type of trends, any type of outlier activity that we can correct early on in the process. So I got where you were going with that. Also, something that could assist greatly in regards to improved results is leveraging some type of technology, right? Technology could be anything as simple as a QA evaluating platform, something that not only gives you a segue to have your scorecard or your QA form inputted, but also something that could provide data screen captures, as well as any type of guide for automated reports. So that's the cool thing about having some type of evaluation platform to leverage. You can get automated reporting in regards to any detail of what's going on correctly or areas of opportunities that could occur through a call flow. And heck, you know, since we're even mentioning tools, why not talk about voice analytics? Voice analytics could be obviously used to either score automatically some type of QA interaction, as well as provide tips throughout a phone call to reduce handle times or guide that representative and or specialist in the right direction if going astray throughout an interaction. And obviously the key is when done right.
Did you all hear that? When done right. I think this is a good time for us to review why to outsource QA. So the first thing that I want to mention, and I feel is very important to me, is reduction of distractions for the site medical assistant or the manager. By not having them focus on such a manual admin task of evaluating and reviewing processes, you'll give them more time to focus on what really matters. And what's that? It's patients at the location and their checking exam experience. Now, if you look at another factor, it's the cost factor of it. Having such a specialized resource working on tasks like evaluating is a misuse of the resource, since it does not it does actually require um, undivided, uninterrupted focus
Yeah.
to go through the calls, identify and really grade the accuracy. So when you outsource this for a much lower cost to a well-trained third party, it leverages maximum use of the medical staff for what they need to be doing on site.
Oh, yeah, definitely. And giving them more face-to-face time is actually a direct impact to improving that patient experience, as well as potentially any call appointment setting sentiment that could go on later on. Um, you also get the quality of service, I would say, that you desire. Why? Because you would participate in mapping out the framework to what matters most. And consequently obtaining the flexibility of any changes in processes, any changes of procedures, any flashes that need to go to the site and the QA staff needs to target or look at, could be part of that process and start evaluating practically immediately. You know, not that we want to recall the harder or harsher times of COVID, but you know, the quickest example of flexibility is COVID protocols. You know, everything changed overnight. We were worried, all of us, about the safety of our employees, the safety of our patients, the safety of the medical staff at the different practices, and scripts practically changed overnight. And to make sure that this is well taken care of, streamlining that information and ensuring that it's included in a quality audit process is key to guarantee that our specialist in every single moment is always doing what's right through that interaction for all of the parties involved and the influence that they have on those different parties that are involved. And at the end of the day, having that level of flexibility and adaptability to making fast, timely changes to be measured with a quick turnaround time, you basically get to elevate performance to the standards that you desire. Elevate. Think about it.
Well, Elevate. Elevate Performance with Care is actually our branded quality assurance product at CCD. So what we do here, just so you guys can have an idea, our task is to mix the QA results with program management criteria. That creates an engagement between the specialist to the brand. And it also provides objective alignment. It sustains performance, as well as it has an accountability indicator that works through systemic development. Well, I'm not going to say anything else, but I'll just say, if you're interested in knowing more, I'll tell you a secret. Just reach out and we can help.
Yeah, so thanks, Stevenson, for that. But yes, you know, Elevate is our performance with care secret here at CCD. And basically what we've done is we've aligned our QA framework to have a well-embedded win-win feedback process to educate at the different levels of the staff within our organization, as well as our care specialists, most of all. to drive morale, empathy, and multiple areas of our organization. At the end of the day, some of the main takeaways that we have from our chat today is key performance indicators. When they're well defined, they create and leverage a great framework for quality assurance all across. It will drive continuous improvement and as a direct result, provide a smooth call flow to impact patient experience. Ensuring empathy above all, when applied, will move that patient experience in a direction where possible for added referrals and increased conversion rates, as we mentioned earlier on. And finally, outsourcing your quality process can potentially leverage these results as well as a cost saving to improve your return of the face-to-face team at your different locations or different practices. To put it simply, as we would say here in-house, to elevate to the next level. Thank you all for the time today, and Maciel for putting this together.
Of
Thank you,
course. Thank
Marcel.
you. Thank you. Thank you. You guys are amazing. Loved. I loved all the information you shared today. I am pretty sure that the audience also did. Now we
We
have
tried
reached.
to keep it as simple as possible. Keep it lean, right?
Yeah,
Keep it simple.
It was an interesting, like a teaser. So we're gonna have a lot of people interested in this.
Thank you.
I want to invite you, as we said before, to place your questions through the chat. We will be addressing a couple of questions we have here. I see some of those are here in the audience, so it'll be great. I will be starting with a question placed by Shane Popat. And this one it's addressed to you, Lillian, and it's how is quality assurance impacted by analytics and product transformation? Interesting.
Good one. Good one. More as time goes by, we're becoming more and more data driven across all segments, all fields, all industries, right? So having proper reporting in place, be it through a reporting tool, be it through some type of data mining type of system, at the end of the day, you have to have well-defined what you're looking for and what are the different attributes in your framework that are going to make sense to the business and to what granular level we want to view them. For a quality assurance process, we can see anything as global and macro as overall quality score, but then we could go as micro as dividing that through soft skills, accuracy, errors percentages. We could also go down even more granularly into the different types of appointments that are set and how are the educational pieces of these performing at the mammo level, the CT levels, the ultrasounds, what's going on in that dynamic, and that is where you're going to get the transformation. Once you have that granular data where we know where some of these pain points are, combined with net promoter score and or customer satisfaction scores, you create a smart plan, right, based on smart measurable goals. And when these are deployed, transformation will occur. Obviously, you've got to involve everyone, not only the quality department, but as well as the operational staff and the training staff. You can't fix one end of the leg if we're not looking at the system, right?
Definitely, definitely. Thank you, Lillian, so much. Next, we have another question from Lisa Copeland. This one's addressed to you, Stevenson. How can a quality assurance department improve employee turnover and morale at our scheduling call center? And that is a very good question. It speaks,
Yeah.
it speaks directly to
Okay.
something.
Yeah, it sounds like it's speaking to elevate, to summarize it a little bit, but turnover and morale, these two words, they just hit home. So CCD, we're definitely a center that we value the experience as a whole, and then we look at what impact we can actually have on our resources lives and our clients and their customers, or patients. So what we decided to do through Elevate was to move away from holding challenging conversation, as they commonly call them, but rather have a two-way conversation with that win-win outcome that Lilium referred to earlier, which speaks highly of the fact that we are the human center. We leverage our values as we talk a lot about doing what's right, making CCDRs, and the client's values to target that continuous improvement, instead of pinpointing the shortfalls without setting that clear plan of that development process for our resources. When you give feedback, as it's a bliss, like we usually say, when you give feedback and it's received correctly and it's given openly, it's definitely going to ensure that there's clarity in the entire
Yes.
process, and that helps with morale.
Yeah. It's communication, transparency. Yeah, definitely. Hmm.
Yeah, and it to just a little tail end, it neutralizes any defenses that could come up in regards to areas of opportunities encounter. You know, that coaching process and that educational flow of using the core values through the conversations instead of talking to fails and talking to doing what's right and changing a behavior for the impact that it has on the business, the impact that it has on the specialist, as well as the patients, transforms and clicks at the specialist level where they say, wow, everything I say, everything I do through this interaction has an impact or a marker on the patient journey that could cause a lack or benefit of the experience at the tail end of the design,
Yes.
right?
Yes,
I could
indeed.
not have summarized it better.
So, let's take up, this is going to be the last questions. However,
Okay,
please feel free, the audience, if you have any other questions, to place them directly to us, and we'll be answering them as soon as possible. So this one
awesome.
comes from Ethan Greenberg, and it's for you, Lillian. It's, how does the quality assurance department support the even quality across different patients? And that's a tough one.
Yeah.
Ooh, good luck with that one.
Yeah. So thank you, Ethan, for the question. How can it support? It supports through the design. It supports through looking at the journey and the different flow. It also supports by providing possible standardization where it could apply, and by having standardization in different parts of that engagement process, uh, same type of patients, or better said, same type of patient interactions should be at some point calibrated and have that
Hmm.
educational roadmap to ensure that screeners are scheduled in a specific manner. To put an example, to bring it to Stevenson's examples and comments earlier today, obviously different tests do require different protocols. It require different screening questions. It may require different prep information, but having that well mapped out, having that well defined, having a clear training process that will help as a feedback loop, will standardize it where every patient for each one of those interaction types should have a similar experience going all across.
Yes.
And obviously having that framework designed is going to be key to make it happen.
Well,
That's all I can offer.
it was a tough one, but you were really good at that one.
Yes, I'm
I
amazed.
got it.
So, well, both of you, I can't thank you enough. I can't thank the public enough. Thank you all for joining. Thank you, Liliana Stevenson, for sharing all of your amazing experience. I want to welcome the audience to explore our CCD Resource Center, and see there what type of content is suitable for you. Maybe you can find there some questions that are answered to possible hiccups you're having on your practice today. And I also would like to invite you to our next webinars. As you see, on April 21st, we're going to have one. And on June 8th, we are also going to have one. So the party, it's only beginning. You can feel more than welcome to join us in all of those activities and events. And you will for sure see more of Lillian and Stevenson in the process. Guys, thank you.
Great.
Audience, thank you so much for joining us today. And well, I wish you all a nice rest of your afternoon.
Thanks,
Thank you,
everyone. We
Marcel.
enjoyed the time.
Thanks,
Thank you,
everyone.
Marcial, again for making it happen.
Always a pleasure. Bye bye, everyone.
Bye, everyone.
Bye, everyone. Thanks for having us.